Welcome to The Coalition. This is a talk show dedicated to discussing health, wellness, and inspiration. I'm your host, Dr. Shani Belgrave. Hello, everybody. Welcome to The Coalition. I'm your host, Dr. Shani Belgrave. I am a bariatric and minimally invasive surgeon in Atlanta, Georgia. You can learn more about me and get connected at www.drshanibelgrave.com. I am super excited to have on the show today Dr. Dave Montgomery. Dr. Dave is a board-certified cardiologist and founder of PREventClinic. He also is the host of a podcast called the Health Mastery Cafe. He also serves as a medical contributor for News Nation. Dr. Dave, thank you so much for joining the coalition right on time for Heart Health Month.
Absolutely, right on time. There is no better time than now to talk about heart health. I appreciate the opportunity to be on with you.
Thank you. Thank you. So, Dr. Dave, can you please get us started by letting us know a little bit about who you are and what you do?
Yeah, so my everyday job is a preventive cardiologist. I get up every day excited about the opportunity that we have to prevent heart disease, the large majority of which is preventable. So that gets me up and excited not only to treat patients, but to also get out in a larger platform. So I'm also in the media and have been for the better part of 15 years, mass media, social media. Right now, I'm really focusing on my contributor role at News Nation, where we do, weekly hits about a whole range of medical topics. Obviously, it's not just about cardiology, because it turns out that I'm also a physiologist. I was a physiologist before I became a cardiologist. I also am board certified in internal medicine. So we've got this broad knowledge that I want to share, and I love to teach. So there I am in a nutshell. I decided to go off on my own and start a practice so that I could practice the way I think people need and want. And the name of that practice is PREventClinic. We're right here just outside Atlanta in Sandy Springs. Very proud of where we are now. Cardiology, and now, Dr. Belgrave, primary care for the last almost 3 years. So we're really happy about it.
Amazing. Thank you for everything that you are doing. I've seen some of your shows and I love your energy and what you're putting out there. So thank you so much.
Thank you.
So now, heart disease. That's a huge topic. Heart health is so important. What can you tell us in terms of the numbers, the statistics? How big of an issue is heart disease?
The vast majority of the heart disease, as we said, is preventable. The main cause of death in heart disease is a heart attack. That's when a blood vessel blocks off, the heart stops getting blood, and then you go into a rhythm that's not sustainable. There are 800,000 heart attacks every year. 800,000 heart attacks every year. About 200,000 of those are people who have had heart attacks before. Remember what we said, 80% is preventable. Mm-hmm. The deaths come in, and this is the most shocking part, because I always say it this way. Heart disease kills more people than the top cancers combined, but we know how to stop it from killing people. That's a non-numerical statistic, but it really drives home the point, doesn't it? That we know how to stop the number one killer, but we don't do a good job. There's a number of reasons for that, but part of it is that we don't get the information out like you're doing on your podcast to people enough so that they understand the gravity of this condition.
I'm on the edge of my seat, Dr. Dave. How do we stop this? How do we prevent these deaths?
Yeah. Isn't that the answer? Well, we've known the answer for a really long time. And I will tell you that the mainstay of prevention is early detection. The mainstay to prevent somebody from having a stroke or a heart attack is detecting the things that are going wrong early. So one of the failings of the American healthcare system with regard to heart disease is that we don't test enough. I very often will ask people, do you know what the starting age is that you should be screened for women for breast cancer? Boom, everybody gets the answer right. Do you know when is the starting age that you should start to be screened for colon cancer? boom, most people would get, and they moved it a little bit for both of those, right? So it's moved around, but at least they're in the ballpark. People just know this stuff, right?
Right.
And then I might say, do you know when it is for my guys? Do you know when it is? These are harder still, right? Do you know when you should start being screened for prostate cancer? Boy, I mean, still pretty good. Then I ask the question of the number one killer far and away of all conditions, Dr. Belgrave. When should you be tested and screened for heart disease?
Mm-hmm.
Crickets, deer in headlights. And you know why? Because I have to take responsibility for all of us. We have done a really poor job telling people, including the primary care doctors, other specialists, when people should start to be screened for heart disease. And the answer, in my mind, is 40. People with a general risk should be screened for heart disease with a full screen at age 40. You should start to be screening for blood tests and things like high cholesterol, high blood sugar, high blood pressure, much before that. But real diagnostic cardiology testing, 40 years old, across the board, objectively everybody. And because I see every day an opportunity, for example, a woman I just talked to yesterday after her procedure, she is, 68, she looks like she's 58, seriously. She comes to my clinic very frequently with her mother. Her mother's 93. Her mother is the picture of health. And so is the 68-year-old. Well, every time I bring somebody into the clinic, I talk to the family, whether it's somebody young saying, hey, listen, I want you to exercise too, go get your cholesterol checked, or a spouse, hey, if you haven't done this, I want you to do it too. If you haven't done the test I want your spouse to do, you do it too. Same thing with this lady. I said, your mom's getting all of these tests, and she has been for years. Why don't you come get your heart screened? I'm happy to do it. You can go anywhere. Just get your heart screened. It wasn't a shameless plug to come to me, but anybody. Well, it turns out she started the test. I think three tests are in order for most people. One is a stress test. The second one is an echocardiogram, which is an ultrasound of the heart. And the third one is what we call a plaque score. That's a nickname, but it's a coronary calcium CT or a coronary CT, a heart CT. And when you get those three, you have enough information about the cardiovascular, about the heart itself to know if there's a risk that you've got to address. Well, this woman went through the stress test, passed it with flying colors. I mean, she literally is the picture of health. Exercises all the time, trim, she passes her echo. The echo looked amazing. I said, we're not quite done. I want you to go get the plaque score. We want to put a score on the amount of plaque that people have. Well, she went and got the score. The score comes back 898. Well, the normal score is 0. No plaque, right? No calcium. 898. She feels amazing. I'm asking her a question. No, I don't have any symptoms. Well, I don't play with a really high calcium score, particularly in women, because we've been wrong in women before, so I don't play any games with anybody, but certainly not women. So she goes and she has a heart catheterization to really get down to the granular detail. And she had terrible coronary artery disease. So bad that we couldn't just open it there in the procedure. She had to have bypass surgery. Now, I just want to, that's a really long story, but it drives home the fact that here are people, women and men, pictures of health, look amazing, feel amazing, but have severe coronary disease. The bottom line, you don't know, Dr. Belgrave, until you check. That's the key.
What you just said is key information, because I was thinking that we need to do prevention in terms of making sure our cholesterol is in the right range, exercise, healthy eating. But I didn't know that it's recommended that people, regardless of risk factors or family history, everybody, in your opinion, at 40 needs those 3 tests.
Yeah. Now, and I qualify that by saying that is a Dr. Dave Montgomery corollary.
Okay.
Because if you went, and you Googled that at the, pull up the AHA, they're not going to say that.
Right.
Now, listen, I'm a part of the AHA. I'm a fellow of the American College of Cardiology. I get it. I understand. And I do understand why, for example, some of that is not out there. But some of the encumbrances I don't deal with in my private clinic. What I know is we don't test women enough, And we don't test people enough at all after the age of 40. We just don't do it. We look at them, we look at risk factors, and we get thrown off because we still harken back to how we were trained. And that training says if they don't have high blood pressure, high cholesterol, or high blood sugar, they've never smoked, and they don't have a family history, then you really shouldn't worry about it. And that's been proven wrong time after time. Here's this woman. Her mom is 93. She never smoked. Her cholesterol is marginally high. She doesn't have diabetes. She does have a little hypertension. So she's got, one of the major risk factors. Mm-hmm. Here's the end of that story. After the heart catheterization, and it was determined that she had to have bypass surgery by a surgeon, and she did great, by the way, I asked her, tell me, please, listen, let's go back over the symptoms again. Are you sure you're not feeling anything? And she says, the only thing that I ever feel is when I'm starting my exercise. I exercise all the time, don't you, Dr. Dave? I said, yeah, I know you exercise all the time. And she says, at the beginning of exercise, I get a little feeling in the middle of my chest, and if I just keep going, it goes away. So that brings us back to some of these other statistics in a real anecdotal case, right? That sometimes many times, people have symptoms that they either under recognize, right? Under, they don't, it is not represented in their brain. They don't identify it. That's a better word, as a symptom of heart disease.
Right.
There's a statistic that says, some large number of people who have their first symptom of heart disease is a fatal heart attack. And as a scientist, knowing physiology, I really beg to differ. First of all, you can't go ask those people what your symptoms were because they're gone. Mm-hmm. Number two, many people under-recognize the symptoms because they're so broad, particularly women. But here's a woman who had classic chest pain during exercise,
right,
and categorized it in the category of, this is heartburn. I want everybody to understand something. If you have a symptom that is unusual, prolonged, or severe, UPS symptoms, then you go talk to your doctor. Doesn't matter if it's in your throat, in your chest, in your back, it doesn't vomiting. I don't care. If it's unusual or prolonged or severe, go talk to your doctor, and you won't know what it is until you get checked.
Absolutely. Good information. So, what are some of the signs and symptoms of heart attack?
Yeah, there you go. So, and I broaden that, by saying unusual, prolonged, or severe, because the classic symptom is still chest discomfort. This woman that we've been talking about, she still had chest discomfort. She's a woman. Mm-hmm. We are saying that women can have different symptoms, not that they all do have different symptoms. Because if we say that, then we throw the women off, like this woman who had a classic symptom, exertional chest discomfort. And she thinks maybe because women have different symptoms, that can't be what I'm having. The number one symptom of men and women, humans, especially in this country, is still chest discomfort. Number two, you can just be tired and fatigued. You can have nausea and sweating for no apparent reason whatsoever. You're not doing anything and you just break out in the sweat. I want you to be talking about this to your doctor. You can have shortness of breath doing things that you normally do and don't get short of breath. So what I like to do is tell people that while there's so many of these other things, I don't want people to miss anything or try to be the judge of it. If it is unusual, Dr. Belgrave, I really don't care what it is. Talk to your healthcare provider. If you don't have one, go hire one. Number two, if it is prolonged, that means I've had this before, so it's not unusual, but boy, this is lasting a lot longer. It usually only lasts for 2 minutes. Why am I still feeling this 45 minutes later? It's prolonged. No matter what that is, I want you to go and talk to your healthcare provider. And the third one is severe. It doesn't matter what's happening. If something is severe, please don't pick up your cell phone, trying to Google on the way to the emergency room, right? I'm not one of the doctors who tell people not to Google. That's just not going to happen in these days. But I want you to be actively Googling while you're going to an emergency medical attention. UPS.
Awesome acronym, very sound advice, because a lot of patients frequently do go to Google and find themselves very stressed. So that's good advice that as you're trying to figure it out, seek medical attention for anything that's severe. The other thing I wanted to talk to you about, because I feel like a lot of people have an idea about heart attack and signs and symptoms, but something I don't find is talked about as much as heart failure, congestive heart failure. Can you share some information on the magnitude of that problem and signs and symptoms?
Yeah, heart failure is still one of the number one discharge diagnoses in the country, meaning, boy, people come in with a lot of heart failure and they go home with it. We don't know how to cure it completely for people who have certain kinds. Heart failure sometimes gets mixed up with heart attack and with stroke. So sometimes in the lay public, we mix some of those terms up. Heart failure, as the name is implying, is the heart just stops doing what it does. What does the heart do? One of the major things that it does is it pumps blood to every last cell in your body so that those cells have all the nutrients and the goodies and the oxygen that they need to do their job. When the heart doesn't do that, we say it has failed. Now, the heart failure diagnosis doesn't have to be a blanket statement. There are some people who have heart failure and it just occurs for a short period of time. There are many different reasons for that. So, for example, if somebody has a heart attack, sometimes that heart gets weak and it stops being able to pump the blood forward. But as the heart improves and heals, the heart is able to do that again. But for a time, the heart failed. So heart failure means it's just not able to push that blood to the degree that the body needs. If I'm sitting down, it's going to beat a certain way. If I get up and run a marathon, it's going to be beating a completely different way. If I'm in an ICU, it's beating a different way. As long as it's beating according to the needs of the body, you're not in failure. When it stops doing that, you are. And so that's what I want people to know, because sometimes you see heart failure on your diagnosis and you're like, is that the end? And not necessarily, because much of what causes heart failure is preventable. We go back to that, right? The main reason in the country is ischemic heart disease or blocked off artery. A second one, especially for African Americans, people of African descent, is hypertensive heart disease, meaning blood pressure caused it. Now, there are a number of different other reasons for it, but those are the big ones we want people to know. That if you let your cholesterol be high and you smoke and you don't get checked, you can have a heart attack to the point where your heart goes into failure. If your blood pressure stays high, especially very high, for a long period of time because you're trying to get it together. Oh, I don't want to take any medicines. Oh, no, we got to do it natural. But you still eat whatever you want to eat and you don't exercise. If you let your blood pressure stay high for a long time, it will eventually fail. It can't keep doing that no matter whatever your lifestyle choices are. You've got to choose something different. Anyway, I'm preaching. But, so those are the two. Blocked artery, hypertension. And what we want people to know is if we stop the artery from blocking and we treat the hypertension, you don't get heart failure.
Wonderful. This was really a fantastic discussion. What would be your takeaway message for people watching this that are like, I want to take care of my heart. I want to make sure that I'm doing all the right things I need to do that are cardioprotective. What would your takeaway message be?
Yeah, I mean, I think it's very simple. It goes back to that story. If you don't test, you don't know, because there are very many people who feel great. And really, when we dive deeper, it is not great. And we have an opportunity to prevent heart disease and heart disease associated deaths. So you're going to be asking your physician, am I right for a cardiac screen? Am I right for a stress test? Am I right for a coronary calcium CT for a plaque score? Am I right for an echocardiogram? And essentially insist that you get that, particularly if you've got a family history or you have smoked or had smoked, if you've got hypertension or diabetes or high cholesterol, the risk factors, right? I want you to go get screened. You don't know unless you get checked. If you have a heart, you should get it checked. And if
Good,
you're listening,
that applies to everybody.
That's right. Everybody. I know it sounds like, foolish to people who say, hey, listen, I run marathons and I'm a vegan. But I'm telling you, I have vegan marathoners who have heart disease because it's about more than that, isn't it? Mm-hmm. Right? Your genes can be abnormal. So you don't know if you don't check. Go check so that you won't be caught by surprise.
Wonderful. Dr. Dave, for people that have enjoyed this conversation, want to learn more about you and get connected, what is the best way for folks to reach out to you?
Yeah, no, I love to engage with people on social media. So if they would get in touch with me, 2 different places. My podcast called the Health Mastery Cafe. If you'll go to @Health Mastery Cafe on Instagram and Facebook, you can follow me, find me there. Let's DM, answer questions. And then the other one is my own personal page where I post some of those things too. And that's The Good Dr. Dave, The Good DRDAVE, The Good Dr. Dave.
Wonderful. Well, thank you so much, Dr. Dave, for sharing your expertise. I am hopeful that you'll come back to the coalition another time to give us some more information on heart health.
I am looking forward to that day. Thank you so much for having me.
Thank you. Well, everybody, thank you so much for tuning in to another impactful episode of the Coalition. I'm your host, Dr. Shani Belgrave. You can stay connected with me at www.drshanibelgrave.com. Very special thank you to Dr. Dave Montgomery, also known as Dr. Dave of Health Mastery Cafe. You can get connected with Dr. Dave, cardiologist at the PREventClinic, through Instagram at Health Mastery Cafe. Thanks so much for watching. Be sure to like, subscribe, and share this episode with at least one person to raise awareness for Heart Health Month. I'll see y'all next time.